Hello everyone. Today we shall discuss the waffle cone technique of stent assisted coiling. This technique used a stent for coiling, adjunctive coiling, and further to this, now the similar technique has been extended to devise newer devices which include P-coners and neck stent. However, we need to understand this basic so that we can also understand the newer devices. This is our patient with a ruptured aneurysm. We can see this ugly nubbin over the surface of the dome of the aneurysm, and it is wide neck, involves both the A2 segments. The arteries are not that big to accommodate two balloons and one microcatheter or two microcatheter inside. The initial plan was to take a microcatheter in the A2, which is more involved with in the neck of the aneurysm, and initially we took a headway which did not track into this artery in spite of using a distal access catheter and manipulations. I was afraid to rupture the aneurysm as well because the microcatheter and the wire kept looping inside the aneurysm, so this was a difficult one. Then we changed to echelon, so the echelon tracked inside, echelon. We can see that the echelon has gone up to this point. However, it has significantly changed the anatomy of this arterial system. Here you can see the entire artery has straightened. This loop of the A2 has disappeared. So I thought of exchanging the microcatheter. So through this echelon, which was parked somewhere here, we took a Neuro Scout 300, which is exchange length microcatheter. See very well here that there is severe spasm of this artery caused by the micro wire itself, because you can see there's a very sharp loop coming into the aneurysm, involves the neck and then comes here. So this segment has got straightened and that has caused this severe spasm. I took a headway 21 over the neuroscout. However, it kept looping. On looping, the spasm disappeared. However, when the system straightens, there would be spasm. And the headway 21 did not track, like headway duo and also like the echelon. So the echelon got little bit further, but not completely distal. So I checked with the DSA. You could see now that the ACA has got occluded here. It was worrisome now for me. So what I decided was that I will occlude this lobule which has ruptured. So I went with the echelon. Now there are two microcatheters. The headway is just parked here, and the echelon is here, which is curved. The steam shaped microcatheter tip is there, and then I coiled this lobule of the aneurysm so that I had some safety of margin if I have to give some tirofiban or any other drug here. And lo and behold, on removing the headway, the occlusion and the straightening, everything disappears, which was happening with the 17 system as well. And we can see there is no thrombus, nothing, but probably because of the sharp bend here and the double curve, triple curve rather, this artery was not sustaining navigation of the different microcatheters and wire system. I have to forego the thought of stenting that ACA, and I thought of now using this waffle cone technique. So we can see here a solitaire has been deployed. We can see these markers, distal marker. The solitaire has been opened inside the aneurysm. We can see the delivery catheter. So there are two catheters here, one for coiling and one for the delivery of the stent. Coiling continues. This was a 5/15 coil, so we can see the previous coil in the lobule, and this is in the main body of the aneurysm. To deploy coil safely inside the aneurysm, here we can see good progress. However, there seems to be some small clot formation at this point. Not resolved, and we can see the arteries are well patent now. We can see the aneurysm is occluded. There are some loose coils at the base. However, there is adequate occlusion of the lobule as well as the dome and the fundus. We can see that there is reasonable coiling. The stent is open. All the arteries and the bifurcation is open. Unsubtracted view, we can see there is dense coil at the base also. We can see the stent markers. The solitary stent is not that well visible. However, the markers will be seen, and we can see that the A2s and the A1 as well as the neck of the aneurysm is paired.